Thomas, why are we having so many women in Texas die in childbirth? It just seems odd to me, and I've heard for several years that this has happened. And why is it happening, and what can we do to stop it?
Hi, Emily. Thanks for your question. I think what you're referring to is the recent national publicity that Texas ranks #1 in the nation in postpartum deaths for women. This is almost exclusively poor working women, minority women, and single mothers. The statistic is horrifying. It's not only worse in North America, it actually is worse than many third world countries. So yes, there are fixes that we can start correcting this. Here are my 3 fixes. Fix number 1 would be stop rejecting and start accepting our annual $10 billion tax rebate called the Medicaid expansion. Over the past 10 years, our Republican legislators have rejected this tax rebate, causing $100 billion to be denied to our rural healthcare system, causing over 20 of them into foreclosure. Fix number 2 would be stop closing down women's healthcare clinics. We need to start building small health clinics in rural communities and focus on the working poor, minority women, and single mothers. These 3 groups suffer the most from postpartum healthcare emergencies. Fix number 3 is about providing some low-cost but very professional healthcare services for the working poor. Fix number 3 is creating a public education healthcare network using the United States Public Health Service COSTEP model that would build local clinics and build 24/7 kiosks that are linked to regional hospitals and other teaching hospitals such as UT Southwestern. The COSTEP program is a program whereby anyone of any age can get their tuition paid for free in any healthcare field, so long as they work in a public capacity for the same amount of years that they went to school. In closing, let me say that most of these are not new ideas. These are old ideas, good ideas that Americans had that we abandoned, years ago. We need to bring them back. My name is Gary Don Thomas. I'm running for the Texas House, District 62. That's Fannin, Grayson, and Delta counties. My main issues are education, healthcare, and infrastructure in rural North Texas, broadband, low-cost internet everywhere. So I hope you follow me. My website is Thomas for Texas House. And I have a Facebook site, too, of the same name. We need donations. We have an Act Blue. And we need volunteers for, the phone calls and the postcards and putting up signs and so forth. And remember, when you vote, there's no more straight ticket voting. That's gone now. You'll have to seek out your candidates one by one, all the way down, and find your favorite Democratic candidate, the one that you're rooting for, and vote for him. And don't forget page 2 and page 3. Don't get to the bottom and think you're done. So anyway, that's my message for today. Thanks a lot.